in this video, I will be administering the intramuscular injection. So the first step is to perform hand hygiene and observe the appropriate infection control procedures. This is to reduce the number of microorganisms on the hand. So since I am done washing my hands, I will now proceed to the next step. Prepare the medication from the vial or ampule for drug withdrawal. Organization of necessary procedure facilitates accurate skill performance. The next step is to provide privacy. Provide privacy by shutting the curtains. This will make the client or the patient feel comfortable. So the next step is to introduce self and verify the client's identity. This is to give assurance to the client. Verify the client's identity by checking the ID bond or bracelet to gather information. So assuming that this tomato is my client. Hi, Mr. Tomato. I am your student nurse for today and I will be administering intramuscular injection. Is that okay, sir? Okay, sir. And after assisting the client and introducing ourselves to the patient, we will now proceed to the next step, which is to assist the client to a position depending on the chosen site. This is to provide clear visualization and easier contact when administering intramuscular injection. So for vastus lateralis, lie flat or supine with knee slightly flexed. For ventrogluteal, lie on side or back with knee and hip slightly flexed. And for dorsogluteal, lie prone with feet turned inward or on side with upper knee and hip flexed and placed in front of the lower leg. After which, explain the purpose of the medication, including relevant information about the effects of medication. Explaining rationale increases the patient's knowledge and reduces their anxiety. So hi, Mr. Tomato. I will be administering an intramuscular injection in your deltoid site. Is that okay with you, sir? Okay, sir. So after that, we'll now select a site free of skin lesions, tenderness, swelling, or localized inflammation, and one that has not been frequently used, because lumps may indicate a previous injection site where absorption was inadequate. Now, locate the exact site for injection. So I chose, or assuming that I chose the deltoid site. We collect site identification decreases the risk of injury. The next step is to put on clean gloves. So since I am done washing my hands, I will be now putting on clean gloves to promote safety from any pathogens. So the next step is to clean the site with an antiseptic swab and use a circular motion. Start at the center and move outward about 5 centimeters or 2 inches. Allow skin to dry. So I will be using a cotton swab and an alcohol to clean the area. Because cleansing the injection site prepares it for injection. So the next step is to remove the needle cover and discard without contaminating the needle. So I will be using the 3cc syringe. This technique lessens the risk of accidental needle stick. So the needle is now exposed. Use the ulnar side of the non-dominant hand to pull the skin approximately 2.5 centimeters or 1 inch to the side. to lift the adipose tissue up and away from the underlying muscle and tissue. Now hold the syringe between the thumb and forefinger of the non-dominant hand. Inject needle quickly and firmly at a 90-degree angle and insert the needle into the muscle. This position prevents accidental medication loss while inserting the needle. And after that, we'll now release the skin. To avoid injecting into the compressed tissue. After which, we'll hold the barrel of the syringe steady with your non-dominant hand. Aspirate by pulling back on the plunger with your dominant hand. Aspirate for 5 to 10 seconds. Aspiration ensures that the needle tip is located at the desired site and has not accidentally punctured a blood vessel. Now, slowly inject the medication. Injecting slowly reduces discomfort, allowing time for the solution to disperse in the tissue. After that, quickly withdraw the needle while applying pressure with a dry sponge. Because slow needle withdrawal may be uncomfortable for the client, so we have to do it quickly. And after, we will now assess the client to a comfortable position. This is to provide patients comfort. Discard the uncapped needle and syringe in a safe receptacle. I will now cover the used syringe and dispose it in a sharp bin. It is because most accidental needle sticks occur while recapping needle. This prevents injury. After which, we'll now remove gloves and wash hands. It is because this prevents the spread of infection. And lastly, document all relevant information. Documentation provides coordination of care.